So today we will be discussing about the management of status epilepticus in children. So status epilepticus, which is a continuous seizure activity which may last for more than 30 minutes or a series of seizure form from which the child does not regain his level of consciousness. Okay, so here the initial treatment is mainly directed towards supporting and maintaining the vital functions of the body, that is, maintaining the airway breathing circulation. And next, administering the oxygen and gaining an IV access, which is immediately followed by IV administration of the anti-epileptic drugs. So what care we can do in the home or before the child can be reached to the hospital. So as per the recent studies and research, it has been believed that rectal diazepam, this is a very simple and effective drug which can be given safely at home or in any situation before the child reached to the hospital. So these diazepam, they are available in pre-filled rectal syringe for the easy administration. So this can be easily available from the medical shops and all. So this can be get and this to be inserted into the rectum of the child. So this rectal diazepam, which is not having any associated complications like respiratory depression and all. Then apart from rectal diazepam, midazolam also can be given, but this is given through the intranasal route. So here this is effective for stopping the seizure, but it is very easier to administer to the child than that of the rectal diazepam. Okay. And regarding the hospital management, so usually in the hospitals, the status epilepticus child is managed with the IV diazepam or lorazepam, and they are the first line of drug of choice. But recently, lorazepam is replaced by IV diazepam because which is having a longer duration of the action and less respiratory depression among the children below the age of 2 years. Then along with that, concurrent IV use of phosphonatoin can be also given to control the seizure activity. Then valproic acid also reported to be very effective in the management of status epilepticus when it is given rectally or intravenously in the child. Then after the administration, the child must be closely monitored for any alterations in the vital signs which may indicate respiratory depression. So lorazepam and diazepam is associated with the respiratory depression. And when diazepam is ineffective, phosphonatoin or phenobarbital can be given to the child IV route as a second line treatment, but there is certain complications associated with the respiratory system like apnea the child will develop. Hence, constant monitoring of the respiratory function as well as the respiratory support is necessary. Then the child who continue to show the seizure activity despite the use of all these drugs like phosphonatoin, lorazepam and diazepam or any other phenobarbital etc., such child can be given the anesthetizing medications like midazolam, propofol or phenobarbital. Okay. And next is regarding the management of febrile seizure. So febrile seizure means, according to the International League Against Epilepsy, they say that a seizure in association with a febrile illness in the absence of any central nervous system infection or acute electrolyte imbalances in the child who is older than 1 month of age and without any afebrile seizures. So which means these febrile seizures are not associated with any febrile disease conditions or it is not associated with any central nervous system infection or any non-electrolyte imbalances. And one more thing they are saying, and these kind of febrile seizures have not developed in the child at least 1 month of age without any afebrile seizures. Okay. And next is regarding the incidence. So this is one of the most common neurological condition which may affect up to 8% of the children. Most commonly seen among the child in between 6 months and 3 years of old, and the peak is between 12 and 13 months. And usually they will disappear after the age of 5 years, and boys are affected more than the girls, and there is a family history also seen. Okay. And the etiology, the cause is still unknown, and it is believed that if the body temperature rises above 38.8 degrees Celsius, the seizure activity will develop. Sometimes it will begin in the dramatic beginning of the illness or an upper respiratory tract infection or a gastrointestinal infection. and most of the time these febrile seizures will be stopped by the time the child is taken to the nearby hospital. And let's see the regarding the management. So during the attack of these febrile seizures, usually the child will be in the home or in the school. So you can make the child to lie on their side to prevent the aspiration from the mouth, and don't try to put anything into their mouth. At the same time, do not restrain the patient or do not restrict their movement when the convulsions are happening. If any sharp objects or any furniture, anything is causing injury to the child, those things can be removed away from the child. And regarding the medical management, what we can do is we have to reduce the fever of the child with a certain acetaminophen or any ibuprofen, etc. So usually, when you see the child is having the increased body temperature in the beginning of any respiratory or any gastrointestinal problem, we can reduce the child's fever with these medications, or we can give certain tuppet sponge, etc. to the child. And since the majority of the febrile seizures are not lasting upon this child and they don't create much effect upon this child, and hence it is normally recommended not to provide any anti-seizures medications to prevent the seizure activity. So this is regarding how we can manage status epilepticus as well as the febrile seizures. Okay, thank you.